Hello everyone, and welcome back to MediInsights. Today we're covering Baclofen Injection, an intrathecal treatment for severe spasticity. I'll explain what it treats, how it works, typical dosing, and the safety points you must know in a clear, practical, patient-focused way now. First, we'll explain what Baclofen is used to do. Baclofen injection is given into the intrathecal space via a spinal catheter or implantable pump to treat severe spasticity that has not responded to oral therapy or causes intolerable oral side effects. It is commonly used for spasticity from spinal cord injury, multiple sclerosis, cerebral palsy, and selected stroke or brain injury cases. Patients are usually assessed with a screening bolus before long-term pump therapy is considered. Let's cover the usual dosing and any timing tips. Before implanting a pump, clinicians perform a screening bolus, commonly 50 micrograms in adults, to confirm clinical benefit and assess safety during the trial. If the screening dose is effective, the initial continuous infusion is usually set conservatively, often as the screening dose delivered over 24 hours or double the effective bolus spread over 24 hours, and then titrated to effect. Maintenance doses vary widely between patients, and clinicians adjust the infusion slowly based on spasticity control and side effects. Here's an easy explanation of the medicine's action. Baclofen is a selective agonist at GABAB receptors, and when delivered intrathecally, it directly reduces spinal motor neuron excitability. This action decreases flexor spasms, clonus, and associated painful spasm by enhancing inhibitory neurotransmission at the spinal level. Because it acts at the spinal cord, intrathecal delivery allows lower systemic exposure than high oral doses. Baclofen can have side effects. Here are the common ones. Common effects you should expect include drowsiness, dizziness, weakness, and nausea, and some patients report vision problems or unsteadiness. Serious complications can include respiratory depression or altered consciousness with overdose, and abrupt interruption of intrathecal delivery can cause severe withdrawal with fever, increased spasticity, autonomic instability, and even seizures. Any sudden change in tone, fever, or consciousness after pump issues requires urgent medical assessment. And finally, don't forget these safety tips and warnings. Always confirm benefit with a supervised screening dose before considering a pump, and make dose changes slowly while monitoring breathing and motor function. Never stop intrathecal baclofen abruptly, and ensure the pump and catheter are checked promptly if symptoms worsen or the pump alarm activates. Discuss goals with the care team, report excessive sedation or breathing changes immediately, and coordinate follow-up for refill and device maintenance to avoid interruptions. Thanks for watching MediInsights, where clear medicine matters. If this helped you, please subscribe and leave a comment with questions or topics you want covered next. Stay safe, ask your clinician about suitability, and see you in the next video.